Hey guys, welcome back. It's been a long time since I've made a video. So let's grapple onto something very important, that is the sinuses of the brain or surrounding the brain. So sinuses are large collections of venous blood. Okay, so sinuses are of many different types and of many complex names. So today we'll be discussing about the various names, their course, what they start as, what they end into, and all of those good things. Okay, so let's begin with the superior sagittal sinus, which is the one that is present right running along here. So it begins at the crista galli in the front, and then it goes upwards, then backwards, all the way up to the internal occipital protuberance. And at the internal occipital protuberance, the superior sagittal sinus, it continues mostly as the right transverse sinus. Okay. Now another important thing to know is that the superior sagittal sinus is triangular in cross section. Okay. And then there is an inferior sagittal sinus. The inferior sagittal sinus, unlike the superior sagittal sinus, doesn't run the entire course. It only runs the posterior two-third. So the inferior sagittal sinus begins somewhere here and then runs two-third backwards, and along with the great cerebral vein, it forms the straight sinus. So now the straight sinus, in turn, which was formed by the inferior sagittal sinus with the great cerebral sinus, it continues forward and forms the left transverse sinus. Okay, the left transverse sinus. Now after it forms the left transverse sinus, the two transverse sinuses have now been formed. So now what we need to know is the left and the right transverse sinus, they run along a posterolateral course. So they're running from backwards to the side of your head. So as they run, there is a mastoid process here. So the moment they reach the mastoid process, they bend down immediately and form what is known as the sigmoid sinus. And the sigmoid sinus marks the end of it mostly. And the sigmoid sinus on the left side, which is a continuation of the left transverse sinus, which was in turn formed by, I would like to know what you think in the comment down below. Let's make it interactive. So the left sigmoid sinus is what becomes the internal jugular vein that we see and appreciate so often in head and neck region. And the other thing you have to know is some of the branches of this sinus which go on to enter the cavernous sinus. Now, what are these branches? So we spoke about the left sigmoid sinus, which continues at the internal jugular vein. Whereas the right sigmoid sinus, it gives us certain branches like called the superior petrosal sinus and the inferior petrosal sinus. So now they come together and they end at the cavernous sinus. And there is another sinus called the spinoparietal sinus, which is from the front part of your face that comes backwards, and that also connects to the cavernous sinus. Okay, so I hope I have given you a good mental picture on what is what and what is going where. Okay, basically that was the idea. Another important thing I would also like to say is some of the things you have to remember is the sinus related problems, such as cavernous sinus. There is cavernous sinus thrombosis, which is due to injury to the dangerous area. Now why is that? It is because these sinuses or the tributaries to these sinuses, as we were discussing, are all valveless. And valveless means they allow for retrograde infection. It can go backwards or it can be propelled forwards. Okay, so that is the thing. So an important criteria to diagnose the cavernous sinus thrombosis is severe pain in the eye and the forehead region, and it involves the third, fourth and sixth cranial nerves. Now why is that? It's because 3, 4 and 5, which is the oculomotor, trochlear and trigeminal, lie on the lateral wall of the cavernous sinus, and the sixth cranial nerve, which is the abducens nerve, and the internal carotid, they lie within the cavernous sinus. So any symptoms that are relevant to these structures would indicate cavernous sinus thrombosis. And another important thing is there will be a pulsating exophthalmos. The eye will seem protruded because of involvement of these abducen and oculomotor nerves, because these are the ones that control the eye movements, the intrinsic and the extrinsic muscles. So these are some of the points I really want to discuss early in the morning, fresh. Let's all do well in our exams. All the best, guys.